Hi, my name is Priscilla Tran, and I'm going to be doing my presentation on nutrition therapy and the health promotion theory. I will be going over nutrition, hydration, and diet therapies, application to prevention of diseases, health promotion model, cultural and spiritual assessment, including a scenario, how to achieve optimal outcomes, and the impact on advanced nurse practice. I will be going nutrition, hydration, and diet. Nutrition has developed over the years since the early humans and is continuing to develop as more is understood about the body. Chinese nutrition. Chinese are known to have lower rates of obesity, diabetes, and other chronic diseases and cancers. They focus on the relationship between the body and environment. They also utilize herbs and foods, which are important for maintaining health and healing. Chinese herbs can be used for illness and producing milk for breastfeeding. An example would be cinnamon twigs, which are used to decrease the blood sugar. A balanced diet. Diet therapy can be used to prevent diseases, lengthen lifespan, and assist in treating diseases and illnesses. It is important to have a balance between carbohydrates, essential fats, and proteins. Carbohydrates are important for energy. There are two kinds, simple and complex. Simple carbs break down into sugars in our body very quickly. Complex carbs absorb more slow. Fiber is a type of complex carb that is not absorbed. It is an important function in digestion, and we need 25 grams a day. Protein is important in growth production and maintenance of cells and other substances in our body, such as antibodies. There are two types of protein, complete and incomplete. Complete proteins come from animals, eggs, soybeans, and dairy. Incomplete protein comes from beans, grains, vegetables, and nuts. Fats are important for growth and function of the cells in our body. There are three main types, which are saturated fats, which come from meats, polyunsaturated fats, which come from soybean, and monounsaturated fats, which come from olives. Vitamins and minerals are necessary in many functions of our body, such as creating red blood cells and maintaining skin tissue. Hydration is another essential function to our body. It allows things such as allowing the blood to circulate to the different organs and tissues. There are multiple types of diets. Two such types are vegetarian vegan diets known to decrease high blood pressure, rates of diabetes, colon cancer, and asthma. Another diet is a high-protein diet, also known as the Atkins diet. This can be used for short-term weight loss, but is not good for long-term health. Nutrition therapy and disease management. Nutrition therapy can be used to decrease risk and manage symptoms of chronic diseases, such as heart disease. A diet would include a low-fat, increased intake of vegetables and fruits, increased whole grains, intake of lean protein, limited sodium intake to up to 2,300 milligrams a day, and decreased intake of unhealthy foods. Another disease would be hypertension. The DASH diet, which stands for Dietary Approach to Stop Hypertension, has been very common. This diet includes increased vegetables and fruits, limited sodium to 2,000 a day, increased fiber intake of low-fat and fat-free dairy, intake of lean protein, whole grains, and increased nuts intake. The DASH diet can also be used for diabetes. Other diabetic diets include increased complex carbs and fibers, decreased simple carbohydrates, increased healthy fish, increased monounsaturated and polyunsaturated fats. Hypercholesterolemia diet would include increased fruits and vegetables, increased monounsaturated and polyunsaturated fats, complex carbs, limited red meat, limited whole fat dairy, and increased intake of healthy fish. The health promotion theory focuses on preventing diseases and staying healthy rather than curing diseases. There are four assumptions, which are that people want to control their own life and behavior. Second, people People are in constant interaction with their environment in which they are influenced by and influence their environment. Third, it is the responsibility of the healthcare professional to positively influence the individual throughout their lives. And fourth, it is important for the individual to initiate the change in behaviors in their lives and their environment. The goal of this theory is to promote one's health in order to reach optimal well-being, personal fulfillment, and productive living. Nutrition and diet therapy is an important health-promoting behavior. It is important for nurses to educate patients on nutrition and diet in order to optimize their well-being and manage their diseases. Cultural and spiritual assessment. The patient is a 55-year-old female of Chinese descent. The patient was recently diagnosed with hyperlipidemia and was told that a vegetarian-based diet would help to control her cholesterol levels. She would like to try this out. First, assess the patient's lifestyle, culture, religion, and types of food she likes to eat. The patient currently follows no religious domination, lives in Southern California, and eats a lot of Chinese takeout and fast food. It is important to include the patient's cultural foods in this new diet of hers. Due to the patient's eating habits, culture, and interest in this new vegetarian-based diet, the patient can be educated on eating more tofu to replace meat for protein and other soy products, steamed vegetables with light sauce, for example bok choy, which is very common, and brown rice instead of white rice. How to achieve optimal outcomes. The patient should be referred to a registered dietitian in order to assist with nutrition, education, and dieting. The patient should check in with a dietitian every month to monitor how the patient is eating and assess the struggles that she is facing. It is important to continue to empower and encourage the patient on her healthy eating habits. It is also important to provide nutrition tracking tools to monitor how the patient is eating, which includes how much percentage of each food group that the patient should eat. Exercise should also be included in the patient's treatment regimen. Last, it is important to provide education and information on what types of foods to include in order to eat a healthy and balanced diet. Impact on advanced nurse practice. Nutrition and diet therapies can be used as an adjunct to Western medicine. It is the responsibility of the advanced practice nurse to provide education to the patient on what kinds of foods are nutritious and also provide suggestions for what types of foods the patient should eat. The nurse should also have follow-up appointments with the patient in order to track his or her health and diet. In accordance to the health promotion model, the healthcare provider should empower the patient to change his or her eating habits in order to reach optimal well-being.